the Finnish National Indoor Air and Health Program, which is a big project that I'm part of. And as Olga told you, I'm a medical doctor, used to working in a hospital, nowadays do practice as well, meeting asthmatics, and indoor air is a subject that comes up in a pulmonologist office quite often. Is it linked to lung diseases? Yes, probably in some extent, but let's see what we are doing in Finland nowadays. Well, the claim that we have in this program is that clean and fresh indoor air promotes health and well-being. We know that indoor air can contain large amounts of pollutants that can cause a variety of symptoms and reduce well-being. And individual exposure agents can also increase the risk of permanent disease. We know there's a link with radon to lung cancer. We know that there's not that strong link, but a link with molds and asthma in children, and in some extent with adults as well. We know that if there's exposure to cigarette smoke, there's an increased risk of COPD, lung cancer as well. There are many things that affect. And the primary principle in Finland is to prevent and reduce indoor air exposures with strict regulations and by intervening on damages in the buildings. Well, in Finland, major steps to solve problems related to indoor air has taken place for quite some time. There is legislation, guidelines, guidance, research, and the levels of most of the relevant indoor air pollutants are lower in Finland compared to the rest of Europe. But in other hands, there are perceived symptoms related to poor indoor air quality, and they are really common in Finland. This is a discussion over here that people don't feel well inside their houses or workplaces or schools or daycare buildings with children. And there's a lively public discussion on indoor air problems and a certain mistrust towards public authorities and building owners. And this probably relates to, in some extent, to healthcare providers as well. But this has been a discussion in Finland for 15 to 20 years. I think the pandemic has taken it down a bit, and the public discussions is on other subjects now. But this has been a kind of special discussion in Finland. We don't see that in this extent in other countries. Well, the Finnish National Indoor Air and Health Program, we started to prepare this in about 3-4 years ago. And it started by the National Institute of Health and Welfare. And it has been an extensive preparation, and there are various stakeholders. And what we found out we needed is research-based information, and this is part of the program as well, and workshops and online surveys to kind of gather information. What are the opinions of healthcare workers, public workers, patients, and have this sort of bilateral consultation with our stakeholders. We've done interviews to indoor air experts from Sweden, Norway, Denmark, and Iceland as well, because we want to have a broader picture of this subject and taking measures to promote health and well-being. And well, what we gathered, the key problems with our current state is that the general public needs more information, and all they display mistrust at some point. And the management of problems related to indoor air must be developed and should be more systematic. And the situation of those with symptoms and illnesses is partly unsatisfactory. When I've seen this patient, the problem is that people might have really severe symptoms, and we as doctors cannot find a particular illness in this patient, and that's why we need to develop this sort of system that these people would get treated as well. And then we found out that the competence of various actors must be strengthened so that GPs would have better knowledge how to treat patients, what are the things that causes illness, and perhaps what are the issues that must be stated when meeting patients. Well, the program is named Healthy People in Healthy Premises, and the primary long-term objective is to reduce health and well-being hazards linked to indoor environments in Finland, providing information, assessment of indoor air problems, treatment and support, and education and training. And me, as working in Finnish Lung Health Association, our part in this program is the education and training of healthcare providers. Of course, as lung specialists, we can offer advice how to, like, do guidances, how to treat patients, but this education and training is the slot I'm doing. Well, if you think the program, how to prevent hazards, how to deal with communication, treatment and support, we need assessment of indoor air problems, treatment and support, education and training, providing information. And I think the general thing there is to build trust and have this open research-based discussion. Of course, if you have problem with indoor air, you have to go there and get it fixed. And we need to know that the buildings are healthy buildings, and we need processes and guidelines and legislation to do that. Well, the program progress that was to reduce health and well-being hazards linked to indoor environments in Finland was the primary objective, but indicator 1 for us is to reduce, have symptoms associated to indoor environments to be reduced by 40% in Finland by the year 2028. I think that's a big number, but that's one of our goals. And second one, the proportion of people satisfied with indoor environments in Finland to be increased by 50% by the same year. So big things are to be planned, and we are doing this although there's a pandemic going on. And this program is designed so that the progress will be continuously monitored. And there are these indicators that need to be met. And in addition to these indicators, outcome indicators are used to describe how the planned action are realized. Well, this is the outline that we have. The preparation phase been done, and phase 1, we are there now. And there have been, I think, almost 20 trainings we've done for Finnish healthcare workers this year, and it continues next year as well. And we have these internet-based trainings we've done, and this program is designed so that it will further take shape when we are doing this. But this is an important public discussion as well. It's politics, it's healthcare, it's buildings. There are lots of things to be taken in consideration too. And I want to thank Professor Juha Pekkanen for helping me with the slides with this program, and I want to thank you.
Thank you, Tuuli, very much for your presentation. Well, that's amazing policy planning document you have in Finland, covering so many key players. Well, I'd like to ask you a question. What's your feeling up to now? How enthusiastic are those key players? We heard that, well, with society, it's a probably bigger challenge. It's longer way to go to move their understanding, rise their understanding on the issue. But you mentioned a lot of other key players. So how enthusiastic they are in going together to this way?
I think that's always a push to get these sort of things started. And but when you get into it, you kind of get excited as well. And this is a difficult discussion, especially with different sorts of neurological symptoms and allergy-like symptoms and asthma and breathing difficulties, itchiness of eyes that people report getting from poor indoor air. And because of our public discussion, the first thing that people think here in Finland is mold. And perhaps there is mold in indoor air and in the buildings they are in, or they're not, but they are having symptoms. And it's very difficult when people have strong opinions when going to doctor and they have already decided that this is the main reasons I'm having symptoms, to then go through the symptoms and bring like science-based knowledge of what probably causes the symptoms and probably not, and to have this sort of non-polarized discussion about things and what is happening in their bodies. Is it dangerous? What's going to happen? And this is the sort of things we're trying to do with this program.